South Dakota is home to 9 tribes, each with its own unique government structure and leadership. These tribes play a significant role in South Dakota's economy through casinos and other businesses. The tribes include the Cheyenne River Sioux, Lower Brule, Crow Creek, Flandreau Santee, Oglala, Rosebud, Sisseton Wahpeton, Oyate, Standing Rock, and Yankton Sioux tribe. They have a rich history in the state, and many of their members still reside on reservations. The tribes are vulnerable due to historical injustice, socioeconomic disparities, and lack of resources. The impacts of colonization and forced assimilation have led to high rates of poverty, unemployment, and substance abuse. Limited access to quality healthcare and education further exacerbates their vulnerability. Organizations and initiatives are working to support Native Americans in the area through advocacy, outreach programs, and community engagement to address root causes of inequality and provide meaningful support for this marginalized population. Natives do have access to comprehensive healthcare coverage through the Indian Health Service, IHS, a federal agency that provides healthcare services to American Indians and Alaska Natives. The Oyate Health Center in Rapid City offers a range of medical, dental, behavioral health, and community health services to tribal members and their eligible descendants. In addition to primary care, patients can receive specialty services such as cardiology, podiatry, and optometry. Native Americans also have the option to enroll in private insurance plans through the Affordable Care Act's Marketplace or Medicaid expansion. High rates of poverty and unemployment are prevalent within the Native population. This financial instability can make it difficult for individuals to afford health insurance or cover out of pocket healthcare costs. In addition, the Indian Health Services, which is designed to provide healthcare services to natives, is often underfunded and understaffed. This can lead to long wait times for appointments, limited availability of services, and a lower quality of care compared to what non-natives may receive through private healthcare providers. The lack of resources within the IHS can also worsen an individual's ability to finance their care. Some natives may face challenges due to cultural and language barriers. This can lead to misunderstandings with healthcare providers, difficulty navigating the healthcare system, and ultimately, reduced access to necessary care. Individuals may incur costs related to miscommunication or lack of understanding. Overall, the combination of high poverty rates, underfunding of the IHS, and cultural and language barriers can create significant financial obstacles. Efforts have been made to address these barriers through various strategies, which include improving access to healthcare services, the recruitment of more professionals, enhancing health insurance coverage, providing culturally competent care, fostering collaborative partnerships with tribal organizations, and conducting health education outreach initiatives. Natives face significant health implications due to the complexities surrounding their insurance coverage or lack thereof. IHS provides healthcare services for Native communities, but many individuals may also have private insurance, Medicaid, or Medicare. However, disparities still exist in insurance coverage, hindering access to quality care for some. One key issue is the limited reimbursement rates for services provided by IHS facilities, which can lead to challenges in funding and delivering comprehensive care. This results in longer wait times, limited specialty services, and fewer options for treatment. Some individuals may not have coverage at all, making it difficult to afford essential care. This lack of insurance can lead to delayed diagnosis, untreated chronic conditions, and overall poorer health outcomes. Addressing these issues requires a diverse approach that involves increasing federal funding for the IHS, improving coverage options, enhancing culturally competent care, and increasing community outreach. The Indian Child Welfare Act, ICWA, is a federal law enacted in 1978. It was created as a response to the high rates of Native children being removed from their families and placed in non Native foster or adoptive homes. The Act prioritizes the welfare and best interests of Native children by requiring placement preferences be given to Native families, tribes, or organizations. ICWA also mandates that Native children be placed in culturally appropriate settings to maintain ties with their tribal heritage and identity. Cultural competency plays a vital role in providing care to children and families in compliance. Providers must honor cultural requirements, beliefs, and values of the child's community. Tribes will have the authority to participate in decisions concerning placement, care, and medical treatment. Children and families benefit by preserving cultural identity, strengthening families, upholding tribal sovereignty, improving outcomes, and providing legal protections. Preserving ties to the past aids in achieving a greater sense of well being. Involving tribes in the decision making process respects their inherent rights. Legal safeguards ensure fair treatment and uphold the rights of natives within the child welfare system. Applying the Triple Aim framework to Native Americans involves addressing their unique healthcare needs and disparities. First, improving health outcomes involves focusing on preventative care, competent services, and access to healthcare facilities. Initiatives such as community health programs and telehealth options help to overcome geographical barriers. Second, enhancing patient experience requires trust and respect for cultural beliefs and shared decision making processes. Lastly, reducing overall healthcare costs can be achieved by streamlining care coordination, implementing evidence based practices, and investing in long term solutions.